Morning walk or exercise you would like to do every day, but you can't stay long. You got trouble breathing. What might be that? Maybe you have asthma, but how will you know you really have asthma or not? Let's be confirmed with these symptoms. If you have chest tightness or pain, wheezing when exhaling, which is a common sign of asthma in children, trouble sleeping caused by shortness of breath, coughing, or wheezing attacks that are worsened by a respiratory virus, such as a cold or the flu. If you feel the symptoms, you must have asthma. Asthma is a long-term disease of the lungs. It causes your airways to get inflamed and narrow, and it makes it hard to breathe. Asthma is a serious disease that affects about 25 million Americans and causes nearly 1.6 million emergency room visits every year. With treatment, you can live well, although it can affect your daily life. Contact with allergens, certain irritants, or exposure to viral infections as an infant or in early childhood when the immune system isn't fully mature has been linked to developing asthma. Exposure to certain chemicals and dust in the workplace may also play a significant role in adult-onset asthma. Even then, a question may arise in your mind. What is asthma and why do people get asthma? Asthma is a sudden worsening of asthma symptoms caused by the tightening of muscles around your airways. This tightening is called a bronchospasm. During the asthma attack, the lining of the airways also becomes swollen or inflamed, and thicker mucus more than normal is produced. Genetics, pollution, and modern hygiene standards have been suggested as causes, but there's not currently enough evidence to know if any of these do cause asthma. Although the exact causes of asthma are not known, scientists continue to explore what causes asthma, but we do know that these factors play an important role in the development of asthma. Genetics. Asthma tends to run in families. Genetics plays an important role in causing asthma. If your mom or dad has asthma, then you are more likely to have asthma too. Allergies. Some people are more likely to develop allergies than others, especially if one of their parents has allergies. Certain allergic conditions are linked to people who get asthma. Respiratory infections. As the lungs develop in infancy and early childhood, certain respiratory infections have been shown to cause inflammation and damage the lung tissue. The damage that is caused in infancy or early childhood can impact lung function long-term. Environment. Contact with allergens or exposure to viral infections as an infant or in early childhood when the immune system isn't fully mature has been linked to developing asthma. Exposure to certain chemicals and dust in the workplace may also play a significant role in adult-onset asthma. Some people with asthma may go for extended periods without having an asthma attack or other symptoms, interrupted by periodic worsening of their symptoms due to exposure to asthma triggers such as exercise or exposure to cold air. Now, the issue is how deadly this disease can be. Asthma attacks can be fatal. Because asthma constricts airways, it can be fatal when someone cannot breathe properly after a certain amount of time. A severe asthma attack can prevent you from getting enough oxygen into your lungs and can even stop your breathing. In the case of fatal asthma, the narrowing gets to the point where you can't get enough oxygen in and can't get enough carbon dioxide out. While there's no way to prevent asthma, you can design a step-by-step plan for living with your condition and preventing asthma attacks. Identify and avoid asthma triggers. A number of outdoor allergens and irritants ranging from pollen and mold to cold air and air pollution can trigger asthma attacks. Find out what causes or worsens your asthma and take steps to avoid those triggers. You may learn to recognize warning signs of an impending attack, such as slight coughing, wheezing, or shortness of breath. But because your lung function may decrease before you notice any signs or symptoms, regularly measure and record your peak airflow with a home peak flow meter. A peak flow meter measures how hard you can breathe out. Your doctor can show you how to monitor your peak flow at home. If you find yourself relying on your quick relief inhaler, such as albuterol, your asthma isn't under control. See your doctor about adjusting your treatment.